and Ranking Member Wyden. Thank you, Secretary Scalia, for being here today. As Congress responds to the impacts of COVID-19, one of the main issues that I hear about from New Hampshire constituents is delays in receiving unemployment benefits. New Hampshire is one of several states still working to fully implement the expanded unemployment benefits under the CARES Act. As issues arise, I hope that the Department of Labor will continue to support the state and help ensure that New Hampshire workers quickly receive the support that they need. My first question, Secretary, is about the unemployment benefits we've been discussing. As our country has responded to COVID-19, expanded unemployment insurance has helped to ensure that workers have the financial support that they need when measures such as stay-at-home orders are in place. As Senator Casey mentioned, unemployment benefits also support workers who themselves are sick or at an increased risk of the virus, helping them afford to stay out of the workplace to protect themselves and others. So Secretary Scalia, yes or no, do you agree that during this unprecedented time, unemployment insurance has been an important tool to support public health strategies to contain the spread of COVID-19?
I do agree with that, Senator Hassan, and in fact, in the first half of March, we issued a guidance document even before paid leave was made available for employees of small employers. In FICRA, we issued a guidance document demonstrating to the states how the unemployment insurance system could be available to assist workers who had COVID or were caring for somebody who did. So I do agree with that. And just one last point in the first part of your question.
I have several questions.
I understand. We understand the difficulties that states have had processing benefits. We genuinely are here to help. We have been in touch with all of the states, but if we can do more, please have the folks in your state system let us know, and we'll do all we can.
Well, thank you. And I just wanted to follow up on your answer about the unemployment benefit being a public health tool, because despite what we think the economy may or may not look like in July, we do know that this pandemic will still be with us. And we do know that that will prevent critical challenges for our workforce as they try to balance this new world. Senator Stabenow talked about the capacity for employers to use unemployment benefits to supplement part-time work, which may in fact be very important for families where childcare is still not available at the beginning, or school may not be available, especially if we don't provide more state and local aid as they face budget crunches. So I just want us all to keep that in mind. I wanted to ask you too, Secretary, about the issue of expanded paid leave for many workers, and you just referenced it a bit ago. In addition to expanded unemployment insurance, Congress also enacted emergency expanded paid leave for many workers. This leave includes 2 weeks of paid sick leave and up to 10 weeks of additional paid leave for parents whose children's schools have closed. Access to paid sick leave is an important public health tool to encourage workers to stay home if they are sick without losing their paychecks or possibly their jobs. The Department of Labor is tasked with ensuring that workers are aware of their rights to paid leave, but data has indicated that many workers who are eligible for this leave are unaware of this new program. Secretary Scalia, what additional actions will the Department of Labor take to improve its outreach and education to workers regarding their access to emergency paid leave benefits?
Senator, I will take a look at what guidance we have on that currently. I will tell you that when FICRA was enacted, we engaged in a very intense campaign to provide guidance, answer questions for workers and employers so that they were familiar with the program. We put out a series of 5 or maybe even 6 frequently asked questions to provide guidance. We featured it prominently on the website of our wage hour division, and we also very swiftly put in place rules to implement that benefit. I will note that we have enforced that. We've recovered nearly $650,000 for workers and brought benefits to approximately 500 workers in our implementation of that program.
Okay,
Mr. Secretary and Mr. Chair, I'm going to ask for your indulgence for just a
yes.
moment, please.
Yeah, you
because-
state your question and he can answer it and then we'll go on to the next one. We still got 10 people here, so that's
All
at
right.
least,
I
that's at
will
least
just
50.
say, my question is this, and it's one I will follow up with the Secretary after the hearing, but I just want to put the question on the record. One is that we still need to have the Department of Labor do more because people are not aware of their paid sick leave rights under the legislation. And I would like to follow up with the Secretary about the issue of workforce training, because since 2001, state formula grant funding levels under the Workforce Innovation and Opportunity Act have fallen by 40% as adjusted for inflation. So we're going to need to think about how our workforce systems can help get workers who have been dislocated by COVID-19 back to work, and what kind of additional federal resources will be necessary to support these workforce training and reemployment activities. Thank you, Mr. Chair, and thank you, Mr. Secretary.
Senator Enzi.
I'm sorry, Mr. Chairman, just to respond quickly, again, we put out a very extensive set of documents to explain to the American people how that program will work. I'd certainly be happy to look at it again. And with respect to help to dislocated workers, in addition to all the things I've mentioned earlier, we actually have made dislocated worker grants to 40 states in an amount of approximately $225 million.
Senator Enzi.